As the weather is cooling down, flu cases going up, especially this year. That's according to new data from the county. And a local pediatrician says there is another virus that's impacting children and teens. News 8's Chris Groh live at Rady Children's Hospital with everything we need to know here. Boy, a lot of things going around here, Chris.
Yeah, many of you at home may be wondering, with COVID-19 still very much going on, why are we talking about the flu? Well, that's because the county is basically identifying a key spike here. There were 6 cases at this time last year of the flu. As of Saturday, more than 190 cases. So again, that is alarming to those in charge of trying to keep track of that data, trying to make sure that we are notified of when something like the flu is going around and it's strong like we're seeing right now. And according to Dr. Mark Sawyer, again with Rady Children's Hospital, time to get the shot.
To avoid getting swept up in another big epidemic, we need to get everybody vaccinated now with their flu vaccine.
And of course, last year's low flu case numbers came when so many of us were inside due to COVID-19 restrictions, as well as efforts to try to stop the spread. The prior 5-year average of flu cases at this time was about 128. So again, we're still higher than the previous 5-year average. Now, as for the flu vaccine, anyone over the age of 6 months old is eligible to get it. It takes about 2 weeks for people to develop immunity. Now, Dr. Mark Sawyer with Rady Children's Hospital also teaches at UCSD. He says this year is going to be especially challenging, not just because of the flu and the spike we're seeing of that, but also of other viruses that are making a comeback now that we're congregating together, like RSV amongst teens and kids. But COVID-19 continues to present the most challenges, especially when it comes to the flu in an instance like this. Take a listen to what else Dr. Mark Sawyer told us.
It's going to be impossible to tell the difference between influenza and COVID. And so if you want to reduce your chances of having to stay off of work or not go to school or whatever will happen if you have respiratory symptoms because people think you have COVID, then get a flu shot.
And for those who are especially urged to get a flu shot, those with pre-existing conditions, those who work in healthcare facilities, as well as those 65 and older. In fact, for those that are seniors, you can ask specifically for a senior flu shot. Now, for more information, you can go to our website, cbs8.com, and click on that story link. Eric and Netta.